Healthcare. It's a word we hear all the time, right? But if you ever stop to think about what it actually means for an entire country to provide it, well, we're about to dive deep into that global puzzle of healthcare. Who's delivering the care, who's footing the bill, and the really tough choices that shape the kind of treatment you and I get.
So think about it for a second. The last time you went to a doctor, who actually paid for that visit? Was it the government using your tax money? Was it a private insurance company? Or did you have to pay for it directly? The answer to that simple question really gets to the heart of how a country's entire healthcare system is set up.
Okay, to really get into this, there's one key term we need to know: health service delivery. Now, I know it sounds a little technical, but it's actually pretty simple. Think of it as the master blueprint for how a country gets healthcare from the hospital to the people. It's the whole network that makes sure everything, from a simple flu shot to major open-heart surgery, is organized and, hopefully, accessible.
Generally speaking, these systems fall into one of three main buckets. First, you've got the public sector, which is run and paid for by the government. Then you have the private sector, which is run by businesses and individuals. And, as you can probably guess, most countries actually use a mixed model, which is, a blend of the two.
So, first up, let's focus on the providers themselves. Let's just forget about the money for a second. Who are the actual people and organizations running the hospitals and the clinics? Who is delivering your care?
You see, at their core, these two systems are playing a totally different game. Public systems are built on this idea of equity, the belief that healthcare is a fundamental right for every single person. Private systems, on the other hand, often operate more like a business, competing and innovating to offer specialized services that, well, make a profit.
And of course, these different approaches come with their own pros and cons, right? There are always trade-offs. In a public system, you get that amazing security of knowing you have access, but the trade-off might be longer wait times for certain procedures. In a private system, you might get in faster and use the latest tech, but that comes with a high price tag, and sometimes the profit motive can lead to, say, more treatments than are strictly necessary.
This is exactly why most countries end up somewhere in the middle, with a mixed model. They're trying to get the best of both worlds. The government provides a basic safety net for everyone, while the private sector can step in to offer more specialized, high-end care. The goal is to mix public equity with private efficiency. But even that can create its own issues, like a two-tiered system where quality of care can depend on how much you can pay.
Okay, so we've got a handle on who's running the hospitals. But that brings us to the elephant in the room, doesn't it? Where does all the money come from? Let's follow the money and see how these massive systems stay afloat.
It really boils down to three main sources. You've got public funding, which comes from government money like our taxes, with the goal of covering everyone. Then there's private funding, which comes from our own pockets or from insurance premiums. And finally, you have donor funding, which is when international organizations step in to help fund healthcare, especially in lower-income countries.
Which leads us to this massive question. It seems kind of obvious, but you have to ask. If a system has more money, does that automatically mean people get better healthcare?
And the answer is a big, resounding yes. I mean, just look at the contrast here. When a system is well-funded, it's not just about having shinier hospitals. It means you have enough doctors and nurses, modern equipment, and access to the latest medicines. It all leads to better health. But on the flip side, underfunded systems are stuck fighting shortages, overcrowding, and long waits, and that directly impacts the quality of care people receive.
For a perfect real-world example, just look at the Scandinavian countries. People there pay high taxes, but a huge chunk of that is a direct investment in their public health. And because of that commitment, they consistently have some of the best health outcomes in the world, things like higher life expectancy and lower infant mortality. It really proves that smart public funding pays off in a big way.
All right, let's bring this all the way down from these huge national systems right to your wallet. We've talked about these big models, but how does this actually affect you when you get a medical bill in the mail?
For millions and millions of people, the answer is what's called out-of-pocket payments. And it's exactly what it sounds like. You're paying for the full cost of your care right there on the spot. In places without a strong universal system, just one unexpected illness can be absolutely financially devastated.
So you can see the problem, right? How do we protect ourselves from these huge, potentially crippling costs? Well, the main tool that we've developed as a society is, of course, health insurance. It's basically a way of pooling everybody's risk so that one person's massive medical bill doesn't end up bankrupting their entire family.
And that insurance isn't a one-size-fits-all deal either. It comes in a few key models.
You've got national insurance, run by the government and paid for by taxes. There's employer-based, where your job is your ticket to getting coverage. You can also get private insurance, which you buy for yourself. And finally, there's community-based insurance, which is a really cool model where local groups pool their money together to cover people who might otherwise be left out.
So, when you boil it all down, here's the key takeaway. Every single system we have talked about today, no matter where it is in the world, is trying to perform this incredibly difficult balancing act. It's juggling three competing goals: equity, making sure care is fair and accessible to everyone; quality, making sure that care is actually good; and cost, keeping the whole thing affordable.
And that leaves us with one last big question for you to chew on. Imagine you get to design a healthcare system from scratch. But here's the catch. You can only perfect two of those three things: equity, quality, or costs. You have to sacrifice one of them. Which two would you choose, and which one would you let slide? It's a really tough question, and honestly, it's the one every single country in the world is trying to answer right now.